Hi everyone, welcome to Chapter 13 where we will be discussing non-communicable disease. So, non-communicable diseases are hugely important because they actually have a greater burden than communicable diseases in lower, middle, and high income countries. The burden of non-communicable diseases will continue to increase as countries develop both economically and socially. Risk factors relate in significant ways to lifestyle. So, we've all talked about those lifestyle risk factors such as tobacco use, alcohol use, lack of exercise, eating habits. All of these are within someone's control, I should say, for the most part. One of the perplexing things about non communicable diseases is that they are often preventable at a lower cost, and yet they're very expensive to treat once they've developed. So, non communicable diseases cannot be spread by an infectious agent. They last a long time. Often, you'll hear the word chronic while used with non communicable diseases, and they are often disabling and lead to death if not treated appropriately. And as just mentioned, they're often referred to as chronic diseases and degenerative diseases. So, looking at some of the key terms and definitions within non communicable disease. Cardiovascular disease is disease of the heart or blood vessels. This term encompasses both ischemic, I'm sorry, I have the hardest time pronouncing that, heart disease and stroke. And then cholesterol is a fat-like substance that is made by the body and is found naturally in animal-based foods such as meat, fish, poultry, and eggs. I should say that even when one is vegetarian, they do still have a risk of high cholesterol. High cholesterol can often be very genetic in nature. Oftentimes, it can be very well controlled with diet and exercise, but I did want to throw out that disclaimer that that's not always the case, as you will find with a couple of these diseases. Again, diabetes. It's an illness caused by poor control of the body of blood sugar. However, there is a type 1 diabetes that is not attributable to lifestyle and or diet. Once one is diagnosed with type 1 diabetes, they do have to control their diet, but it is not something that can be prevented. That particular disease happens. It's just the luck of the draw. Hypertension is high blood pressure. And then we have heart disease, a disturbance of the heart function due to an inadequate supply of oxygen to the heart muscle. Stroke is a sudden loss of function of the brain due to clotting or hemorrhaging, often caused by high blood pressure. The cost of non-communicable diseases is huge. It includes the direct cost of treatment as well as the indirect costs from lost productivity. Low-income countries are simultaneously facing the high burdens of both communicable and non-communicable diseases as they face these economic and social shifts within their society. So, high blood pressure, high cholesterol, and obesity. Food labeling is a huge, huge factor. Working with producers to reduce processed sugar and salt in food. We must have mass education programs combined with interventions that involve direct communication. I think it's a great broad stroke to provide public service announcements, but really education needs to be and is found to be much more effective when it's one-on-one, doctor to patient or mentor to patient. Public policies and community layouts that promote physical activity are huge. And as we have become a society that is much more reliant on our automobiles, just think of the way that our towns and our communities are laid out and whether or not they promote walkability by providing services within walkable distance of the majority of the population. I'd like to use downtown Boise as an example in an effort that they're trying to make. They are trying to revitalize downtown into more of a living work area that really enables its residents to either walk or bike to anything that they need to get to. Unfortunately, during the 1960s and 70s, and I would even venture to go as far as the 1950s, we saw a shift towards subdivisions, and subdivisions are often either on the edge of city limits or outside of city limits, not terribly self-sustaining, so that it does not promote walkability to access necessary resources. It really utilizes the use of a car. And if we think about some of our outlying communities in Boise, some of our subdivisions that lie on the outskirts of town, you can see how that has really done a disservice to us as far as health outcomes, because we're now relying much more on automobile transportation, thereby reducing our physical activity, possibly, as well as increasing our air pollution. So you can see it's all kind of related to each other. So with non-communicable disease, we need to discuss diabetes just a little bit further. And as I mentioned, type 1 diabetes is not something that can be controlled or prevented necessarily. I should say it can be controlled with insulin, but this is really difficult to manage for those individuals that are diagnosed with type 1 diabetes in poorer countries. And type 2 diabetes is a little bit different. This is where being overweight, poor exercise habits, poor eating habits really come into play. And as the text states, avoiding being overweight is the single most important way to prevent type 2 diabetes. And then for all diabetics, it's cost effective to control blood pressure because it does result and can result in really dire consequences and complications. So cancer, man, when we look at cancer anymore, anything you read, something causes cancer. I think we can all agree that tobacco control is one of the first priorities in getting our cancer rates under control. I don't know that we will see cancer rates under control within my lifetime. It seems like despite all of our technological advances, or perhaps even due to some of our technological advances, we are seeing increased weird cancers, increased rare cancers that previously had not really been on the radar. Early detection is huge in cancer. I don't want to say prevention, but in cancer treatment and diagnosis. This is where your primary preventions of health screenings come in. Prevention is the most cost-effective method because cancer treatment, once you have been diagnosed with cancer and the treatment has been prescribed, it can be very horrendously, debilitatingly expensive over a long period of time, often with not the best outcomes. So this is where really using your primary prevention methods is key to catch such diseases early. So with mental disorders, and that's kind of where we're going with our discussion question this week, is with mental health disorders. The World Health Organization recommends that countries have a mental health policy and ensure that there's a unit of government solely responsible for mental health. There needs to be a set budget, and if there is a budget, it needs to be appropriately high for mental health programs. We need to train our primary healthcare workers in mental health, both how to recognize and how to perhaps refer an individual for mental health care. And then we need to integrate mental health into the primary health care program. Community-based approaches to psychosocial support, basic treatment and referral with task shifting is as needed is going to be key in treating mental health disorders appropriately. And then finally, our future challenges of non-communicable diseases is that we're going to see these continue to grow by a multitude as our population ages, as we become more urbanized, as the world ceases to have global borders, And due to our lifestyle changes, some not necessarily for the good, we're going to see new and more prevalent cases of non-communicable diseases. The number of people with disease will also rise because these diseases are chronic in nature and ongoing and lingering. Low income Low income countries will have to deal with both these non-communicable diseases that are preventable due to lifestyle factors and communicable diseases, which are the result of parasites or bloodborne pathogens, or as we discussed in chapter 12, all of those different methods of transmission. So you can see in the global health aspect, disease overall is a huge ongoing theme. And we're going to face particular challenges in light of technological advances, lifestyle changes, societal changes, the way that our cities are laid out. I tried to make mention of all these things, but they all do have some kind of impact on disease overall. So it just gives you something to think about. I hope you enjoy this week and put a little thought into it. One of the things that we'll be looking at this particular week is having you come up with your preliminary ideas for your global health issues and ethics paper. So health disease or diseases, whether they're communicable or non-communicable, oh man, so much to choose from. So hopefully you find something that kind of piques your interest in that. And if you have any questions, please feel free to contact me via email at tinafreeman@cwidaho.cc or using the Ask My Instructor link on Blackboard. Thanks for your patience over the last week. It's been a little challenging, but we are ready to go and get on with the remainder of this semester. It's going to be fun and busy and challenging, and I hope you enjoyed as much as I do. Thanks, everyone. Have a good week.